So today I'm going to talk about the mental health of visiting home care workers, trying to identify some of the problems and maybe suggesting a few of the solutions. I'd like to just acknowledge my co-investigator, Dr. Ishik Zaitanoglu, also from McMaster, from the business school in McMaster, and my research coordinator, Jennifer Plenderleaf. So visiting home care workers are workers who provide care in clients' homes, and they can include visiting nurses, visiting therapists such as physiotherapists or occupational therapists or social workers, and also personal support workers or visiting homemakers. Home care is, as you know, it's provided in the home, and there's basically a couple of different categories of home care workers. A lot of home care now addresses the needs of acute care clients who are coming out of the hospital and provides short-term care, and also care there's care that's more for chronic people with disabilities or frail older seniors or children with long-term health care needs. And and there's also palliative home care. So in 2002, there were about over 9,000 registered nurses, almost 3,000 licensed practical nurses, and around 32,000 home support personal care workers working in home care in Ontario. I was looking for some more recent figures, and I did come up with a figure from 2006 that said there was about 30,000 home support or personal care workers. So I think those figures are fairly accurate still. It's predominantly a female occupation, so almost 91 to 97%, depending on the occupation, of people who are employed in providing care in the home are actually women. And it's been an under-resourced area in terms of research, because a lot of the research actually focuses on male-dominated occupations rather than female occupations. So there's been a lot of changes, as you know, in the healthcare sector in the many years that have really impacted the sort of the quality of work life of visiting home care workers, and they has implications for the conditions of their work and also implications for their health, and we'll talk a little bit more specifically about that. But as you know, as hospitals restructured and people were getting out quicker and sicker from the hospital, this really changed the nature of home care work. So instead of sort of providing, 20 years ago, the visiting personal support workers, for example, spent 4 hours with clients, and they were able to help them with their groceries and doing a little cooking and maybe take them out for a walk and have a little visit. Now it's kind of in there, quickly have a bath and out you go, and you've got many, many visits each day. And also the nature of their work has changed. It's become, we talk about it, I guess the new term is now called task shifting. And I used to call it sort of the downloading of care, where the kind of jobs that were done in hospitals, kind of practices done in hospitals were now being done by visiting nurses. Some of the jobs that have been done by visiting nurses or therapists were being sort of delegated to personal support workers. So it really has changed the nature of work. So as I've said, that there's a real gap in knowledge about research on mental health and well-being of home care workers. I've been working in this field since about 1995, and there really is, there's a kind of a handful of researchers that are looking at the visiting care occupations. And as I said, the few studies, and the studies that we've done, shows that work can be a mental health risk. But one also has to note that there are the relational aspect of home care work, the working one-on-one with clients, can also be shown to promote mental health. So it's a complicated picture. It's there are some factors that cause increased stress and burnout, but there's other factors, other dimensions of care work that really promote self-esteem and job satisfaction and a feeling of personal accomplishment. So as I've said, I've done a couple of major studies in this area, and the first one in 1996. And that was at the point before we had moved to this managed competition model in home care, where home care in the city that I worked in and across Ontario was basically being delivered by not-for-profit organizations who cooperated together to deliver care to people in their homes. And interestingly, so at that point we were sort of looking at the quality of work life and the health of people who worked in home care. And then after the introduction of managed competition, I thought, well, it would be really interesting to take a look and see what impact that had on the health and the well-being of home care workers. So we did another study beginning in 2002, and we're still writing articles from that data set. The second study was funded by the Workplace Safety and Insurance Board and the Canadian Institutes for Health Research and also SHRC. So the methods that we used in the 2002 study was we began by trying to sort of figure out what is going on in the field, and we needed to talk to the people who were the supervisors and the managers and also the visiting home care workers. So we began with 59 key informant interviews, from a range of occupations, the directors, managers, supervisors, union reps, health and safety reps, board members, asking them, about the working conditions in home care and how they felt that work was impacting people's health. And then we moved on from that to do 29 focus groups with all of these occupations: therapists, home support workers, supervisors, office staff, case managers, and nurses. Our study took place, it was a case study, and it took place in Hamilton, Ontario, which was a sort of it still is a controversial area with respect to the delivery of home care. So following the key informant interviews and the focus groups, we used the information that we collected there to develop a mail-out survey, and that we sent out to everyone who worked in the home care industry in Hamilton. And we ended up with about a response rate of 70% with information from over 1,300 people. And it was interesting. That's an incredibly high response rate for a mail-out questionnaire, and that just showed the interest of the people who were working in the field and really wanted their voices to be heard with respect to their health and well-being. We also had a little incentive where we mailed out a gift certificate for Tim Hortons, for Tim Hortons coffee, and Hamilton is like the Tim Hortons, King Center in all of Canada. It started there, and everyone is addicted to it. So it became known as the Tim Hortons Survey.